How much does cash-based care actually cost? This video are 2025 numbers. We're in 2026 now, but I'm using 2025 numbers because that is what is in the resources that I had to look up some of these numbers. All sources and links are in the description if you want to dig into any of these numbers yourself. In this video, I am going to cover what insurance is actually costing you beyond the premium. We're going to talk about what cash based primary care, physical therapy, mental health therapy, chiropractic care, and functional medicine cost. These are examples of some of the modalities that are covered with cash base. And I'm going to cover some numbers that we actually could research to find and compare to insurance. We're going to do side by side comparison, as well as go over any common questions and scenarios that come up and how to find a cash-based provider. So after you know all this information, at the end of the video, I'm going to give you ways that you can actually search for yourself to find a cash-based practitioner for the things that you're looking for. I'm Susie Rains, and I am the creator of the Centered Care Directory, which is what this channel is about. It's finding client-centered, patient-centered care that is cash-based. So let's get into our first topic. What insurance actually is costing you? Now, before I dive into the details, I'm going to let you know that I have notes that I'm looking at and I'm following because I did the research and I pulled actual numbers from reports that came through in 2025. So if you notice me looking away, it's because I'm checking my notes to make sure I get the right information. Again, if you want to research any of the numbers that I'm talking about in this video, the links to those sources are in the description. Go ahead and click on the links and you can see everything as I saw it. So before seeing a doctor, you already spend thousands. 2025 averages, the single coverage is $9,325 a year. Family coverage, $26,993 a year. That's a 7% increase per year for 3 years straight. As an employee, what workers pay out of their own pocket for single is $1,440 a year, and family is $6,850 a year. So we're going to talk about deductibles because that's just the premium. That's just what you pay monthly. Deductibles, the amount you pay before insurance covers anything. So you're already paying monthly, the numbers that I just shared, but then you also have deductibles. So you have to meet a certain amount of money paid before the insurance kicks in. So basically, you're a cash paying customer at that point until you pay the deductible and then your insurance takes the rest. So 2025 average employer plan deductible single was $1,886. So before insurance even kicks in as a single adult, you're paying almost $2,000 just off the top. ACA Marketplace 2026 bronze plan deductible was $7,476. And most people never hit that number in a year. So you're just giving money to the insurance company. Here's the premium, and now here's the deductible. And the insurance still isn't kicking in. So you pay premiums all year out of pocket. So here's some numbers that most people don't add up. I am going to stop here and take a breath because that's a lot of information. Those are big numbers. So this is an exercise you can do. I want you to pull out last year, 2025. How much was your premiums? So what were you paying the insurance company, maybe through your employer, that was coming out of your paycheck that you were paying, not the employer, but you? Add up that plus your deductible. So if you went to the doctor and you had to pay your deductible before the insurance kicked in, so how much did you spend? Let's say you went in for a procedure and it was $200, but your deductible was $500. You paid cash. You paid $200 cash for that procedure. So add up premium plus deductible, and then plus copays. So maybe you go visit your doctor and it's a $25 or $50 copay for you to just go into the office. Add those up and then add up any uncovered bills. So anything the insurance declined. They said, we're not going to pay that. That is your real number that you paid. That's your out of pocket. That is what you paid for the year on your healthcare. I want you to look at that number and think about what you used healthcare for that you paid for. So what was the value that you got from the money that you spent? So let's just use a random example. Say it's $1,500. You spent $1,500 the entire year, and that's a low number, but I'm just using it as an example. Was what you went to the doctor for worth $1,500? Did you just go in and get a 10-minute appointment and they renewed a prescription and you paid $1,500? Look at the value, how much you spent compared to what the service was that you received. That'll give you a good picture of the value of what you're spending on healthcare. And it's going to be different for everybody. So this is an exercise you can do for yourself. That's just covering insurance. That's just the money going out. So now I want to talk about what cash-based care costs by different specialties. So I'm going to give you some example specialties. These are just ones that there's research on. So I was able to pull numbers for based on reporting that happens from these industries. So direct primary care, monthly membership model with no copays, no billing, no insurance, unlimited visits, and appointments run 30 to 60 minutes versus 10 to 15 minutes with insurance. Same day or next day access is standard. So you're getting a monthly membership with no copays, no billing, no insurance, unlimited visits. You can go as much as you want, and your appointments are longer. And you can get an appointment quicker. So based on, this is a 2024 numbers that came from AAFP, individual adult would pay $50 to $150 a month. Most common is around $100. Children, $20 to $75 a month, and family of four, $250 to $400 a month. What's included? Unlimited visits, in-person or virtual, preventative care and physicals, chronic disease management, and wholesale lab pricing. So labs are probably separate, but they get a wholesale price. So you get a lower cost for your labs. I want to say this is not a replacement for insurance, but I do want to say if you have an insurance plan that is taking thousands of dollars from you and you're not using it, it would be smart to look at a way that you can get emergency catastrophic insurance instead. How can you go find insurance that you only pay a small amount of money in case something bad happens, and then you use the other part of the money that you have left over that you're not paying insurance to cover your everyday taking care of yourself and your family. So there is a place for insurance. It's just not for preventative care. They charge way too much for you to just go see a doctor every so often. So you can pair this cash pay with a catastrophic emergency insurance plan. So physical therapy, I'll give you another example. Physical therapy is a little bit different because of a lot of referrals come from your doctor to have physical therapy appointments. If you haven't met your deductible, you are paying the full insurance negotiated rate. So that means you're paying the full cost of whatever your PT is, your physical therapy, whatever they charge. So insurance negotiated rate is $150 to $180 per session. A typical physical therapy runs 6 to 12 sessions, so you could be at $1,000 to $2,000 before insurance touches it. So again, you're paying the rate of the insurance, but you're paying cash. So based on 2024, the standard cash-based physical therapy session was $75 to $165. So it's already lower. The highest end is still lower than the average that happens through insurance. Initial evaluation and treatment is $150 to $245, and your session lengths are 45 to 60 minutes. Cash physical therapy often is less per session than insurance negotiated rates. Longer visits, no prior authorization, and no session caps. So you can go as much as you want. You can go as often as you want, as much as you want. And you know the price. They'll tell you this is how much it costs per session. So the flexibility is there. You don't have to worry about getting referred. You can just go there and say, hey, I think I need some physical therapy. And you don't have to have prior authorization. You can pay and go. Let's look at mental health. Mental health insurance in-network therapists are often full or not accepting new patients. I've run into this where I couldn't find anybody accepting new patients. That's a big one. There may be people out there that take insurance, but they're full. So many people are using insurance that those clinics fill up really fast. So basically, with mental health, a lot of times people just give up. Like, I can't find anybody. And before your deductible, you're paying the full rate. So if you haven't met your deductible, again, if your deductible is $2,000 and it costs $100 to see a therapist, you're going to pay cash till you get to $2,000. From reporting 2024 to 2025, the national average was $100 to $250 per session. Licensed counselors is $90 to $160 per session. Psychologists, $150 to $250 a session. And telehealth platforms, $65 to $95 per week. Cash-based removes the in-network search barrier. What that means is if you're looking for a mental health therapist that has to fit in your insurance, then you can only look on a certain list. If you're paying cash, you can work with anybody. You pick whoever you want. You know the price before you actually schedule, and there's no surprise bills. It is what it is. You usually pay before you go. A lot of times, many therapists will adjust and have a sliding scale based on income just to help out people who might not be able to afford a higher price. That's something to look into. And cash-based, again, another thing about cash-based practitioners, we are in charge of our pricing, not an insurance company. We get to actually make our pricing. So we can adjust the pricing on a sliding scale if we want to. Okay, let's look at chiropractic. Again, these are numbers that I was able to pull. 2024, standard adjustment was $60 to $200. National average is $75 to $100. That's a standard adjustment. The initial consultation, $149, and follow-up, $82. Cash only practices charge $57 a session on average. This is just an average. Insurance billing practices charge $70 on average. Again, because they have to get reimbursed by the insurance company. Cash only is cheaper, lower overhead, and savings passed to patients. So because chiropractors are able to take cash, and if they don't use insurance, then they actually can have savings that goes to the patients versus insurance is taking a cut. So they may charge a certain amount, but the insurance is keeping some of it, so they're not getting the full amount. They do membership and package pricing also. A lot of cash-based wellness practitioners have packages. So you can buy maybe a package of sessions. It's cheaper to buy 10 sessions than it is to buy one per session. So that's another flexibility thing with cash-based is seeing someone cash-based. You have more flexibility as a patient client to ask these questions. Say, do you have something that costs a little bit less? Is there a way that I can do a payment plan? Many cash-based people have this because they are not having to ask the insurance company if that's okay. They're not having to get approval for a certain type of treatment to be charged a certain amount. None of that exists in a cash-based practice. Last one we're going to go over is functional medicine. And this one's mostly cash-based. Insurance doesn't cover necessarily this way of practicing because it's extended consultations and root cause testing. So this is what I was talking about in my other video when I was sharing that my nurse practitioner couldn't run certain labs. She couldn't run certain labs because the healthcare system runs on a symptom and treatment plan. So basically, the protocol is set up that if you have certain symptoms, then we're only going to test labs for these certain symptoms. And you can only get the labs that relate to that symptom. And based on that symptom, if the labs come back a certain way, then you get this prescription to manage the symptom. And that's the only thing that the protocol looks at. Where functional medicine looks at root cause. Root cause means I'm going to test your labs that may be outside of the symptoms that you're having, because you could be having something happening in a different part of your body that isn't related to the symptom that's causing the symptom. And if that gets confusing, I'm going to do more videos on this, but basically you're looking at the whole body and how the systems all work from a lab perspective. So you can really get a picture of, oh, if we adjust maybe diet or movement or do some physical therapy in this other area, it's going to improve the symptoms that look like they're being affected in this other area. So the model requires time and comprehensive labs, which neither one are reimbursable under insurance. Because again, the insurance model is based on symptoms and treatment and prescriptions. So it's treating the symptoms. And that's not how functional medicine works. So many functional medicine doctors are only cash based, and you're going to get way better results than just getting a prescription to just treat a symptom. So, what it typically costs, the initial consultation, 60 to 120 minutes. So, you get an hour to 2 hours with your functional doctor, $200 to $500. Follow ups, 45 to 60 minutes, is $150 to $300. Labs often significantly less than hospital rates because they have direct pricing, and sometimes functional medicine doctors will work with a specific lab. They might get discounts to put their patients through that lab. So it costs more per visit than a copay, but you're finding the root cause. So I'm going to give you an example to think about. Let's say your initial consultation is $200, or even go high, it's $500. You're like, wow, that's a lot of money. Well, that's 10 copays. So I'm going to say you're having a symptom of something. You go to your doctor, you pay a $50 copay to see your doctor, and it may or may not meet your deductible. So you're still paying cash, and the symptom isn't getting fixed. So you're going there and you're getting a prescription, and then the symptom comes back. You do the prescription, symptom comes back. Or you keep going back because other parts of you are now breaking down. So you have a prescription and now you have another part of you that's not happy. If you do that 10 times, you paid for one consultation with a functional medicine doctor that could find exactly what was causing the symptom and fix it for you. It's thinking about these numbers in this way. You see $50 as a copay and you go, that's way cheaper than $200 to $500, but you're not getting the answer you need. You're getting 10 minutes with your doctor and another prescription. So you have to think about, what value am I getting for the money I'm spending? I like to break it down to like real time, what we're doing here. So the key point, cost per visit is more than the copay, but you get an answer. You're going to get a result. The outcome is going to be better. And then you have to see your functional medicine doctor less. So really, if you only see your functional medicine doctor twice a year, then you may have paid $1,000. And what are you paying your insurance company? If you went to the doctor 10 times, you paid $500 for 10 visits, and your premiums. Did you meet your deductible? Yes or no? Maybe. All the other money that's going out of your pocket. And you still don't have a result. You just have prescriptions. So it's worth looking into, and basically you do the comparison. This is where we get to really think about and have choices for how we want to take care of our health. And this is why this channel exists. This is why I created the directory. The more practitioners who are doing cash based to find what is really happening with people and help them get healthy is less expensive than just running through insurance and just being a number in a protocol. So that's all I'm going to say about that. That's a good example, though. So now I'm going to do some comparisons. This section that I'm going to go over is comparisons of the numbers that we just talked through. So again, add up last year's premium plus the deductible plus your copay plus all your uncovered bills. Most people, and this is again just based on research and averages, most people pay 5,000 to 15,000 depending on their plan and their usage. We're going to use these numbers to compare. So 5,000 to 15,000 depending on their plan and usage. And this is for premiums, deductibles, copays, and anything that's not covered by the insurance. So we're going to say, here's a case study. Single adult, relatively healthy, insurance, and this is from ACA Bronze 2025 research. So their premium was $4,560 a year. Their deductible was $7,476 before coverage. Okay, I'm just looking at those numbers. And if I just round that, that's already $11,000 for the year going to insurance that you may or may not be using. Just saying. 2 sick visits, pre-deductible. So you paid $300 because you were sick twice and had to go to the doctor and you didn't meet your deductible yet. So the total was $4,860 with no major health events. You've already paid almost $5,000. So if you did this in the cash-based practitioner system, your direct primary care membership is $1,200 a year. So that's $100 a month. Your catastrophic plan for emergencies, again, having insurance for emergencies, was $1,200 to $1,800 a year. A year. I want to say that again because most people are paying that a month. So your insurance for emergencies, $1,200 to $1,800. And then the total is $2,400 to $3,000 a year. So what is that difference? I want to do the math because this just intrigues me. So we're going to say, we'll just say 4,500 and 7,400. So insurance is 11,900, premiums and deductible before coverage, 11,900. And to use the insurance, 1,200 for cash based, plus we'll do 1,800 because we're going to go high for your insurance for emergencies. And that's $3,000. And you did 2 sick visits. So 11,900. You saved $8,900. Wow. As a relatively healthy single adult, $8,900. What could you do with that money? Okay, let's look at scenario number 2. Family of 4, they have ongoing care needs. So they have insurance through an employer. We're going to look at numbers from 2025. Employee premium is $6,850 a year. Physical therapy, 8 sessions, pre-deductible for $170 per session is $1,360. They have 12 sessions of therapy, pre-deductible, so this is cash, which is $1,800. So their total that they're paying for a family of 4, and they're getting, looks like they're getting physical therapy and then mental health therapy, they're paying $10,000 to $14,000. They're already paying that. That's not covered by the insurance. If you look at cash-based, and if they have a family membership for $3,600 to $4,800 a year, so I'm going to say, let's break that down into months. $3,600, that's $300 a month for a family of 4. If you do $4,800, that's $400 a month for a family of 4. Still cheaper than insurance. Their cash therapy for 12 sessions, same thing that they did before, was $1,716. Their cash for physical therapy, 8 sessions, was $1,040. And they also have an emergency insurance plan. They have a catastrophic family plan, and that's between $2,400 and $4,800 a year. So total, including their emergency insurance, they paid $8,756 to $12,356 for the year. So they're saving at the high end $2,000, and they're saving even more if they're in the lower, if they're paying the lower amount. What's 14,000 minus It could save between $2,000 and $5,000 a year. That's savings. That's money that's back in their pocket. And they're getting the health needs met. They're getting all the things they needed for their healthcare happening. Scenario number 3. So managing a chronic condition. This is something that's real in the US right now. People have chronic conditions, things that they're having to deal with all the time. Insurance. Here's some numbers for you. Your monthly copay, $360 to $600 a year, which means you're visiting your doctor so many times throughout the year that you're paying $360 to $600 a year just to go to the doctor. That's all cash. Insurance isn't covering that. Labs and specialist visits. So if you're getting referred out and you have to go see a specialist, let's say you have a heart thing, your labs plus going and seeing a specialist is $1,000 to $3,500 a year. Your premium contribution is $1,440. So that's just to pay the insurance company to have insurance. Your total with 12-minute appointments. So again, you're not spending time with the doctor or the specialist. You're just paying, and then your 12-minute visit, your total is between $2,800 and $5,540 that you're paying out of your pocket before insurance even kicks in for 12-minute visits. So now let's look at cash-based. You have a membership for $1,200 a year. That's $100 a month. It includes unlimited visits, no copays, 45-minute appointments to an hour, unlimited 45 to an hour long appointments. You get lower cost labs because they can run your labs through a direct pay, which can be cheaper than going through a hospital. Your total primary care management for a chronic condition, not including prescriptions, if you have to do prescriptions, but just to see the doctor and talk about how am I doing? How are things going? Am I getting better? Am I getting worse? $1,200 to $2,400 a year total. That's like half of what you pay an insurance company before the insurance kicks in. Cash-based was actually built for the chronic patient. You can see your doctor as many times as you need to. You can get your labs done and have follow-up and see progress of how things are going quicker and easier for less money than in an insurance model. They didn't put in the catastrophic or emergency in this one. So if you were to say that you are a single person for catastrophic emergencies, you could be paying maybe a higher if you have a chronic condition. So I would say that closer to the $1,800 a year. So again, that's going to be added in, but still, that's less than insurance. I don't know about you, but that just makes sense to me. But everybody's individual. So I want you to take out your own numbers. What you want to look at is pull out your insurance numbers and calculate your premium. What are you paying to just have insurance? What is that premium? What is your deductible? How much do you have to pay in cash before your insurance kicks in? How much are your copays just to go see the doctor, just to have an appointment, a 10-minute to 15-minute appointment? And how much value are you getting in those 10-minute appointments? Are you getting what you need? Are you feeling healthier? Are you feeling better? Are you having the outcomes that you want to have? Are you getting the results that you're going to the doctor for? And those are the things you want to look at and compare when you decide if you want to pay cash. So here's some common questions that people ask. Isn't cash-based care only for wealthy people? This is a big one. I get asked this question all the time. These cash-based direct pay models can start as low as $50 a month, depending on where you are and who you're going to see. High deductibles hit lower and middle income patients hardest. The deductible is what gets everybody. They pay the insurance premium, and then when they have to use the insurance, they go to the doctor and they're like, oh, well, your deductible is $1,200. That's cash out of your pocket. The insurance isn't even kicking in yet. You have to pay that $1,200 before the insurance actually covers. That's why it's only good to have for emergencies and high dollar events that happen. That's what insurance was designed for. A sliding scale is common for cash-based practices because they understand that people don't have a lot of money that they're just throwing around. They'll actually look at people's income and they are the authority on what they say, how much they charge. not the insurance company. So they can actually say, because of your income, I can charge you less. And that's okay. Insurance run practices cannot do that. They can't because the insurance company dictates how much money you take in and how much you get to keep. Insurance doesn't mean affordable. Most insured patients pay thousands. We just did the scenarios. Run the numbers, do research on your own. I totally support people doing their own research. Look at your own numbers. If cash base doesn't fit your needs, then that's okay. I just want to make people aware who may not know it, how much money is going out of their pocket just to have insurance and that it's not even paying for stuff yet. So cash base doesn't replace insurance. You want to look at any catastrophic or emergency type insurance. And that may mean that you decline your insurance through your employer and you do an outside company that does emergency insurance. They're out there. I will do a video looking at some of these in the future. I don't have the data right now, but that's why I have this channel. I'm going to be doing more research and putting out more videos that go into details around things. Health savings and flex spending accounts. Those are another area that I'm going to do a separate video on that talk about tax savings. So maybe you can use your employer to help you with some of these tax savings. You can use these accounts for cash based. So if you can do a low premium plan for emergencies and hospitalizations, that's one that you want to look at too, that you only pay a small amount of money because you don't use it. So it's like having car insurance. Your insurance is low until you have an accident. Then once you have an accident, then the rate goes up because they're like, oh, you had an accident. Similarly, you can look at those types of plans and see what they look like. So what affects pricing? I just want to cover this a little bit before I talk to you about how to find cash-based practitioners. Different things affect the pricing. It's going to be location, specialty, credentials. A lot of times you may have to you could find someone virtually that's less expensive because they work with people across states. So maybe you're in an expensive state, so going in person might cost more, but you could use somebody like telehealth or virtual that has a lower cost. Session length, so however long they spend with you. Some people charge less if they spend less time with you, charge a little bit more if you need an extended amount of time. Membership and package pricing can lower the price per visit. So you might find people that offer pricing that is around packages or multiple sessions. Cash only practices carry less overhead. They pass that on to their patients and their clients. So that's one of the reasons why there's only 10-minute appointments with insurance carrying practices, because they're paying the insurance company and they're paying overhead. So that those two expenses make it so they have to see more patients to generate that income to pay the insurance company and pay the overhead. When you remove the insurance, then all they're paying for is overhead, which means that they can spend more time with each patient and it doesn't cost as much money. They don't have to run people through every 10 minutes. Before I close, how do you find cash-based providers? The Centered Care Directory was founded and created. I did it because I couldn't find a cash-based practitioner and I needed one. I'm in a rural area and I couldn't find anybody that was taking new patients under my insurance. And I was like, well, we need a directory, something that people can go search by location, specialty, and find who are these cash-based practitioners because there's thousands of them across the country. We just don't know how to find them. Insurance companies have lists. So you have directories of people in network of insurance companies, but we out here doing our own thing don't have that. So how do you find a cash-based practitioner? You can Google it and might spend some extra time doing that. The other thing you can do is you can look in the Centered Care Directory.healthcare. Look in the directory that I've created. I'm adding more specialists every day. We're adding more as much as we possibly can to build it up and have more people to choose from. So if you know somebody that might be a good person to put into the directory, give them the link. They can sign up as a practitioner. That is the one place that I found that works. That's why this channel was created, was so that the education piece goes out and then you have an opportunity to search for practitioners. So check out the directory and see what's there, see what's available for you right now as you're watching this video. Our next video that we're going to do, I'm going to cover health savings accounts and flexible spending accounts because I didn't get a chance to do it in this video. It would have made it too long and it's a lot of information. So I'm going to be doing that video after this one. So you can really think about, oh, what's a good tax savings if you're using those accounts with your employer to help you save on some of your taxes around medical spending. I hope you're enjoying these videos. Please hit the subscribe button. It really helps the channel grow and reach more people. My goal is for people to have a place to go and search for cash-based practitioners. And when you hit that subscribe button, it gives YouTube what it needs so that it shares the channel with more people. So I really would appreciate it if you hit the subscribe button, and I'll see you next time.